My name is Sarah Amani, and I'm the Youth Mental Health Network Lead for the South East of England, covering Surrey, Sussex and Kent. I also manage an early intervention and psychosis team covering North East Hampshire and Surrey Heath.
So what do you think are the major issues for information IT in the new NHS at the moment?
I think the issues for IT in the new NHS is that it's becoming a necessity. The world has become so digitized. Everything from banking to shopping is now digital, and the NHS's challenges in terms of resourcing mean that it's becoming more and more apparent that we might have to look to technology to help with the resourcing issue and other challenges as well.
And what do you think the priorities for the NHS organisations will be going forward?
I think there's multiple priorities, one of them being that whatever IT solutions are offered up need to be designed around the user, and the user being the patient or person using the service, as well as the clinician. So any offering that is being devised or implemented needs to keep that at its core. Another challenge is actually getting a cultural shift. Now, healthcare has not been the most rapid adopter of technology historically, so it's about getting people on board early on, using early adopters as champions so that the anxieties and fear of technology are hopefully mitigated.
With all the changes going on in the NHS, what do you think the implications of those changes are to the sort of technology, the ICT side of things?
It's hard to predict, but I think it would go either one or two ways. Either the challenges themselves will be a catalyst for more rapid adoption, because actually the resources aren't there now, the choices are limited in terms of how we meet the growing demands from patients and the population. Or, unfortunately, the other option would be that the resourcing challenge would mean that technology is seen as too expensive, and therefore a compromise might have to be reached where it's not the best technology being implemented, but a substandard option.
Do you think that information and information technology is becoming more essential, important to the NHS services these days?
Certainly from this, working in this area, that has become more apparent in people who access the service actually saying, instead of sending me letters that are piling up in my kitchen, could you actually email me? And instead of me missing appointments and struggling to get another appointment, could you text me and remind me? And actually, if you're putting me on medications, I've got my life that doesn't stop and I'm busy. Could you find a way to make it so that I can be reminded of my care plan and my medication regimen? So I think that that's becoming more and more apparent, certainly in my work and widely with the kind of clientele that we serve here.
Who do you think should attend the event and why?
I think a range of people, so from managers, clinicians, people who use services, because this is really something that will affect them eventually. Probably the most affected group is the people who actually access services. Commissioners, key group, so GP commissioners as well as social care commissioners. And people who do research, because I think the argument sometimes is that without evidence that certain technology works, it's really hard to get it to be implemented at scale. So there might be pockets where it's being used, but it never actually becomes a consistent approach to addressing some of the health issues.
What makes this event, this health informatics event, different from others of its kind?
Yeah, there's several. It's been an interesting month of conferences. So NHS Innovation Expo just took place last week, so I was there, and that was more an open platform with similar sort of speakers. David Nicholson was there. So in some ways it's similar to that. On Monday we hosted an e-mental health conference where we were looking at technology and mental health specifically. But it seems HC attracts a more international audience, and therefore you hopefully can have exchange of information and ideas, not just nationally, but also with international players, if I can call them that.
Okay. Now, it says here that you've got quite a range of partners collaborating on conference content this year. Can you elaborate on these and outline why you have so many partners this year, or does this not apply to you? No, okay.
Sorry.
That's fine. I'll just skip over that one. Right. Something you've mentioned just in your last answer, you said of the events to take on a more international feel. Do you think we can kind of expect more of this from HC going forward? Do you think this is a very important aspect of the conference?
I can only speak for myself, but certainly it's an attractive factor that there are more international speakers as well as companies, because I'm aware that other countries are approaching the challenges, similar challenges in the health service in different ways. Examples like Australia and America have gone about implementation design in certain ways that I think we can learn a lot from. So that's part of the reason why I'm going, is the international offering.
Why should people take time out of their busy schedule and spend the money to go to the conference for a day or two? Why do you think they should take that leap of faith, if you like, to attend this conference?
I think it's important to acknowledge that everybody is busy, and I'll be a bit controversial and say that there's never been a time when we haven't been busy. Typically that's the case of healthcare, but there's this silly saying that, well, I think it's kind of silly, that says if you are given 6 hours to cut down a tree, maybe you should spend at least 4 of those hours sharpening your blade. And these events essentially for me are a space to think really carefully about what we're doing instead of just doing things automatically that keep not failing but not getting the best of results.
What are your own anticipated highlights for this year's event?
I think Desmond Tutu is going to be streaming live. I've always found him to be somebody who's very insightful about humanity and putting the person central to everything we do. So I'm looking forward to that. Hearing the policy context from Jeremy Hunt will be also quite useful. But for me, the most important part, I have to say, is networking. I've had the pleasure of talking to some of the people who will be speaking and attending, so meeting them in person will be a great benefit.
I mean, is there anything you would say to encourage other people from the nursing profession to come?
Yes, I think some of the challenges of IT have been that the clinical workforce have not always been involved in designing or choosing the right solutions for healthcare. So nurses and other clinicians, I think these events are a crucial component. If we're going to be procuring IT solutions that are fit for purpose, then clinicians need to be at those tables where these decisions are made. And to be able to be at those tables where decisions are made, you need to have some level of awareness, and conferences like this can help with that.